Hi, I am Haji Sid Abdul Rafi, and in this video, I am going to discuss on how to properly perform an oral care for a patient. Let's begin with the definition of performing oral care. Now, it is the procedure of keeping the mouth clean and free from any diseases and other problems by brushing and cleaning the mouth, specifically the teeth, gums, palate, and tongue thoroughly. Now, the purpose of this procedure is to prevent dental diseases and halitosis or bad breath. It is also done to alleviate discomfort and to enhance oral intake. Now, in order to perform this procedure, we are going to need the following equipments: towel, basin, cleaning solutions or water, mirror, gauze, toothbrush, toothpaste, gloves, and alcohol. There's also considerations to be made during this procedure. Before starting the procedure, make sure to wash your hands and to wear gloves. During the procedure, make sure to execute it correctly and gently as much as possible to avoid hurting and making the patient uncomfortable. And lastly, after performing the procedure, make sure to document the abnormal findings in the patient's mouth if there are any, as well as other problems such as pain and sore. We can now start with the procedure. We begin with the procedure by assembling articles for brushing and flossing in order to promote efficiency. Provide privacy for the patient by closing windows and doors in order to prevent embarrassment. Place patient in a sitting or high phallus position in order to decrease risk of aspiration. Arrange articles within patient's reach in order to facilitate self-care. If the patient cannot sit, place him in side-lying position. Perform hand hygiene and don on gloves, as these are done in order to reduce microorganism transfer and exposure to body fluids. Place towel across the patient's chest. If the patient is in side-lying position, place a towel and a rubber draw sheet under the patient's head. This prevents spillage and promotes comfort for the patient. Inspect the integrity of the lips, teeth, vocal mucosa, gums, palate, and tongue. This is done in order to obtain baseline data and plan for appropriate care. Assist patient with brushing as necessary. Position mirror and kidney basin near the patient for use during activity. Brush the patient's teeth if he or she is unable to perform self-care. First, hold the brush against the teeth with the bristles at a 45-degree angle. Move the bristles back and forth and in circular motion until all the outer and inner surfaces of the teeth and gums are cleaned. If the tongue is coated, brush it gently with the toothbrush. This is done in order to maintain oral hygiene. Assist the patient in rinsing mouth. Give water and allow the patient to spit in the kidney basin. This is done in order to remove toothpaste and oral secretions. Help the patient in wiping his or her mouth with the gauze. This promotes comfort. Remove the equipment near the patient. And assist the patient in lying down in order to promote comfort. Remove gloves, and return the equipments used to proper place and wash hands. This prevents the transmission of microorganisms. Document assessment of teeth, tongue, gums, and oral mucosa, including any problems such as sores or inflammation and swelling of the gums. This is done in order to properly document the findings for appropriate plan of care.